Cervical cancer affects millions of women worldwide, but thanks to the HPV vaccination and the screening programs, the incidence has come down throughout the world. HPV vaccination, although most effective between the age of 9 to 14 years, can now be given up to the age of 45 years and offers good protection without any side effects. Screening is something that we do to prevent the disease or to catch it in its early stage. All females between the age of 21 to 30 years should get a pap smear done every 3 years, and above 30 years of age, a pap smear should be done every 3 years, or we can do just HPV testing every 5 years up till 65 years of age. Screening helps us to catch this disease in its early stage and helps us treat this condition when it's still curable without any complications or without any extensive treatments.
Cervical cancer is the second most common cancer in Indian females. ये कैंसर 1.25 लाख औरतों को हर साल पीड़ित करता है. Very early stages of cancer cervix are being offered surgery which are curable in itself. Slightly early or advanced stages of cancer cervix are offered radiation and chemotherapy. रेडिएशन एंड कीमोथेरेपी का जो इलाज है ये करीबन 8 हफ्ते का होता है. कीमोथेरेपी इसमें काफी लाइट तरीके की होती है और जो रेडिएशन थेरेपी है 5 हफ्ते एक्सटर्नल होता है और 3 हफ्ते का इंटरनल रेडिएशन होता है. सर्वाइकल कैंसर वी नो इज क्योरेबल व्हेन डिटेक्टेड अर्ली. हम इसको कैसे डिटेक्ट कर सकते हैं अर्ली? प्लीज स्टार्ट गेटिंग पैप स्मीयर्स एट द एज ऑफ 21 एंड also now we have HPV vaccine which can be instituted as early as the age of 9 years.
Today I will tell you 5 most important things about cervical cancer. Number 1. Cervical cancer happens in women who are sexually active in the age group of 30 years to 65 years. Number 2. The single most important cause of this cancer is a virus known as human papilloma virus. Number 3. This cancer is highly preventable. We have a vaccine which could prevent this cancer up to 90% of the times. Number 4. The common symptoms are postcoital bleeding, intermenstrual bleeding, pelvic pain, recurrent vaginal infections. However, in stage 1st or 2nd, there could be no symptoms. Number 5. The treatment is now available and advances in radiation, surgery and in chemo and immunotherapies have made this cancer highly curable.
Cervical cancer, not only a very common cancer but also a very lethal cancer. However, there are a lot of myths which surround this cancer, and that is why most people do not get the right treatment at the right time. So let's debunk a few myths about cervical cancer. Myth number 1, cervical cancer is a death sentence. The fact, no, cervical cancer is not a death sentence. It can be caught early, it can be picked up early, and if caught early, it is a totally treatable and curable disease. Myth number 2, cervical cancer cannot be prevented. And what is the fact? It is one of the preventable cancers. You can get vaccination done at the right age and actually prevent cervical cancer. Myth number 3, pap smears are very painful. No, pap smears are not painful. They can easily be done. So stay aware, stay healthy.